COVID-19 and malaria may have similar symptoms, but are caused by different agents. While COVID-19 can spread from person to person, malaria cannot. This is the focus of what we will be talking about today on the show. But before we do that, we'll give you a little bit of global statistics right after a report that we have for you. This is COVID-19 Myths and Facts. Thanks for joining and welcome on board. While the search for the cure for the virus dominates efforts, the Nigerian Center for Disease Control reported 490 new cases of coronavirus overnight, taking the country's total number of cases to 24,567. Lagos recorded the highest number of infections with 118 cases, followed by Delta with 84 and Ebonyi with 68. Abuja recorded 56 cases, Plateau 39, Edo 29, Katsina 21, Imo 13, Ondo 12, Adamawa 11, Osun and Ogun 8 cases, Rivers 6, Kano 5, Enugu, Bauchi and Akwa Ibom 3 cases each, while Kogi, Oyo and Bayelsa recorded 1 case each. So far, 9,007 people have recovered and have been discharged, while 565 persons have died from COVID-19 related implications. On the global scene, the Johns Hopkins University in the U.S. confirms coronavirus cases around the world has passed the 10 million milestone. Half the cases recorded have been in the U.S. and Europe. It is no news that the virus started in Wuhan, China, late last year and has spread across the globe. More than 500,000 deaths have been recorded so far. The U.S., the epicenter of the coronavirus, has reported a total of 2.9 million cases and 125,000 deaths. 36 states in America are reporting a rise in cases, as experts there say a vaccine may not be enough to produce immunity to stop the outbreak. With over 600,000 infections, Russia came from behind to now have the highest number of confirmed cases in Europe over Spain, UK and Italy that served as the epicenter of the pandemic some months back. Now, over 50% infections recover as search for cure continues. The world has been in search for a cure for what the World Health Organization has called a pandemic. But with over 50% recovery rate, globally that is, the virus has shown itself not to be a death sentence. Now, COVID-19 continues to evolve and comparisons have been drawn to influenza. They cause respiratory disease, but there are important differences between them and how they spread. This has important implications for public health measures that should be implemented to respond to each virus.
Every medication we were giving was malaria medication. Even some people went, before being told that they were COVID-19 positive, they were tested in reputable laboratories in Abuja. They were tested in hospitals in Abuja. And what they found was that they had a lot of malaria parasites in their bloodstream. So when did malaria become synonymous with COVID-19? That is food for thought.
First of all, the symptoms, the presentation of the patient, the feeling that patient gets. Both of the viruses actually have similar presentation of symptoms. Both can cause cough, sneezing, fever, body aches, even vomiting and diarrhea. Both can have that. So you cannot tell from those symptoms that it is coronavirus or it is flu. However, it is suspected that coronavirus can also be transmitted by aerosolization. What does that mean is that if I am sick and I am breathing here, the tiny droplets that are coming out are now suspended in the air and they're just sitting out there. And I have left, but those droplets with the coronavirus sitting on them are here. And if somebody else passes through this area, they might pick up those droplets. So this is called aerosolization. Then is the treatment. Both have supportive treatment. They both do not have antivirals, although there are so many antivirals being tested right now, like ritonavir or remdesivir, but they do not have a treatment yet. In case of vaccination, flu virus, of course, have vaccinations. However, for coronavirus, there are vaccinations that are being developed right now. So there is no vaccine available at this time.
All right, so similarities between COVID-19 and malaria, the flu. Joining me via Skype is Dr. Yemisi Shoyombo, a public health advocate, and we're going to be talking about this. Thank you for joining in, Doctor. Now, expound on the similarities COVID-19 has with malaria.
Good evening. Thank you for having me. It's true. Of course, the COVID-19 symptoms are very relative to what you have in malaria patients. So a malaria patient and a COVID-19 patient might most likely complain of headache. They will complain of pain around their body, joint pains, and they will complain of feeling weak or febrile. So there are very close similarities. The similarities in the spread, although we will always say community, malaria would most likely go to community spread as compared to the coronavirus, food will be spread with droplets from an infected person. So with the spread, the symptoms, they present alike. And now, what's the clip you played there is, oh, I have malaria, but I'm treated with it, which is pretty much it's a challenge now. But still a difference. That's where the importance of laboratory investigation comes in. Yes, but not at the fact that they have nothing, but they, if you have it, the test will show. If test results show, and if it matches the test results show. I will also say that sometimes a patient can have both. That's what challenge for and can be managed or misdiagnosed or put under the cap. As I said earlier, keep making sure that putting two of them together diagnose on laboratory.
At what point should a patient sound the alarm, since they are both similar? At what point should a patient say, oh, no, this is beyond malaria, I think it's what it is?
I would not really give that responsibility to a patient. I would rather say there are protocols that have been set in place as to when you should reach out to call your doctor, like we always say in layman's terms. And going back to the similarities, I would like to also educate the public to know that with malaria as well, symptoms do not even start to show till about 10, 15 days after you've been bitten by a mosquito. Funny, it's almost same with COVID, where they say we have to hold on for about 14 days to see if you start presenting symptoms. However, let's go to COVID. I will, just like the protocols have come out today, if you experience this general symptoms, for instance, that come with either malaria or some other diagnosis, the headache, the fever, the coughing, the weakness, general body weakness, it's always good to still reach out to a doctor, especially where we are, the time we're in now. The coronavirus is a world pandemic right now, but I wouldn't say that for malaria. Malaria is likely close to home. A sub-Saharan problem, as we still have it now. There are no vaccines for either of them, not yet, not for malaria, not for COVID. So I'll rather put it out for reasons of sensitization to say, once you have the symptoms, I don't think it's up to you as a patient to say, I suspect this is how I always feel when I have malaria, or I suspect this is what people have said about COVID. Because that's what has delayed management processes if you get feedback from hospitals. So you have patients who would have been better managed, they come in on time or came in on time, but when you interview them, they say to you, oh, it just felt like I had malaria. I think when I have malaria, this is what I experienced. So I wouldn't leave that up to the patient. When you start to have these symptoms, it's a good time to reach out to a doctor, a medical expert, and they will carry out the necessary investigations.
All right, let me cut you in. Running out of time now. Let me cut you in to chip in on whether or not, I mean, word has it that people are actually opting for the anti-malaria treatment because it's cheaper. That's even if they know it's COVID, but they opt for the anti-malaria treatment because it's readily available and it's cheaper. How true is this?
Yeah, that's true. That's true. Bringing it back home, I mean, the popular hydroxychloroquine is easy to get at the pharmacy. So that's true. And that would somewhat become a public health menace, especially where we are back home now. People are opting for it, even when they don't have any proof. They would rather just go in and buy hydroxychloroquine. But it's also good to let the masses know that that's not a good route, because for all you don't see proof that it's malaria or it's COVID. And drugs, if you speak to the people who, the pharmacists and the pharmacologists, they will tell you medication has side effects. So it's not a good route. Yes, it's cheaper. Yes, it's, and rather than saying it's cheaper, I think the information that has caused that is the information is out there that hydroxychloroquine is one of the routes for treatment or plans for management. So people would rather go there. Oh, it's cheaper, and this is what everybody is saying.
We can go on and on, but time is up and we'll have to leave now. Thank you so much, Doctor, for being a part of the show, and thanks for sharing your thoughts with us in this direction. Appreciate it. And there you have it, the similarities and dissimilarities between COVID-19 and malaria. Just so you know where to draw the line and where to sound the alarm, when to sound the alarm. The quest for the cure is on, but we need to stick to the NCDC guidelines for your sake and for mine. Thanks so much for watching. You take good care and stay safe.